The pros and cons of online therapy.
Online therapy, mental health treatment conducted over the internet by a mental health counselor, has been an effective and convenient option for years. However, in these days of COVID-restricted societies, it has become more of a necessity than an option that has required a certain amount of adjustment for both clients and counselors. The pros. Privacy. Most, if not all, clients highly value privacy when seeking mental health treatment. Online therapy offers additional privacy, as there's no need to go to an office, where one may potentially meet other clients or therapists. This is particularly comfortable for a client who might leave the office feeling emotional and in need of alone time. Time and logistics. No time or cost lost in transport, and a session can even be squeezed in during lunch hour at work or after work at the office. Even the car can occasionally be used as an office. Effectiveness. Research has shown that online therapy can be just as effective in treating mental health issues such as depression, anxiety disorders, and mild to moderate addiction. Accessibility. Anyone with a reliable internet connection can reach an online meeting. This means that people living in remote locations, with disabilities or with children to look after can now easily have access to treatment. Convenience. Online therapy done comfortably from your home often offers you the possibility to have sessions that fit into your own schedule as opposed to standard office hours.
The cons. Confidentiality.
Keeping your personal information private is always a major priority in psychotherapy, but online counseling adds a layer of complexity, especially when the therapist sends information and exercises to the client opposed to handing it over in private.
It's an issue that should be addressed between the client and the therapist. Not in treatment. People who are in acute distress, suicidal, or who have a serious psychiatric illness will need immediate in-treatment or in-person care, and e-therapy cannot provide sufficient assistance in these cases. However, if you're already in an online treatment, your counselor will be able to help you with directing you to the necessary institutions. COVID. Last but not least, online therapy offers the obvious and 100% safe option from contracting COVID in the office and avoiding the hassle of quarantine. We recently had a counselor in the office with COVID, and afterwards clients and therapists who had been in close contact, myself included, had to be quarantined for a week.